Tubies. Alright, so this is video number 2 in my thyroidectomy diaries. I went ahead, I saw my surgeon last week and I got my surgery date. My thyroidectomy is going to be on February the 12th at 10 a.m. Funny story. Funny story. I have a friend, when I was going through the issues with my throat, she was going through the issues with hers also, and we were talking on the phone. And she said she had an appointment with her doctor, and I was like, okay, I have an appointment with mine also. And we were just being funny, saying, wouldn't it be funny if we both ended up having to get the surgery? And she was like, yeah, what if we had it on the same day? Oh, we could be roommates. Well, it just so happens that we don't have the same doctor, but we're going to the same surgeon. And our surgery is on the same date. Mine is at 10, and hers is the surgery before me. So we sit back and we laugh at that. So we're saying, well, if we do end up roommates, we could talk to each other. But she was like, but your throat's gonna hurt. I was like, well, we could text message. We'll hold up signs. Anyway, well, I saw my surgeon, and he showed me my CAT scan films and everything, and he was showing me how my trachea is deviated. I have a goiter, and I have a big nodule inside of my thyroid on this side. Hold on, he gave me information. He gave me this book called the thyroid book, and then he gave me some more information about the surgery and everything like that. A regular thyroid gland is about this size, but mine is large like this. I have a big nodule on this side that is actually making my thyroid like round instead of butterfly shaped. And then I have three new nodules on this side. So he's saying with the big side, it is deviating my trachea over to the right. And my esophagus at the top is really, really small. And that's why food is getting stuck in my throat. You know, and I'm having to like really, really chew my food before, you know, I can get it down, and I'm having to go behind it with something, water or something like that. So yeah, he gave me some good literature. I've been reading it and everything. My surgery is in less than 2 weeks. The week before that, it says I can't have any aspirin, Coumadex, Plavix, or anything like that. But I'm not on any of that. I really don't like taking medicine. Even though I'm about to have to take medicine for the rest of my life. What else? I tried to reply back to everybody who left comments on my first video. I really appreciate it because everybody said such sweet things. I want to say thank you so much, you know, for the prayers, the support. There was one in particular that I tried my hardest, and YouTube was not letting me reply to her comment. What's her name? I think her name is the Sophisticate. Hey girl. You were asking, you asked me something about another procedure, or was it or something to the effect of, was surgery the only option? In my case, surgery is the only option for 2 reasons. One is that food is getting stuck in my throat. It's like something that has to be done like now, and I can't really just wait to see if something else will happen or will work. Also, too, I'm about to get laid off on my job, so it's kind of like I have a few more months left on my job, so it's almost I have to get everything done now while I still have insurance. So yeah, I'm trying to think, is that it? He told me I'm going to take 2 weeks off of work. What else? I asked him about when could I exercise, and he told me, he said in about 2 weeks I could exercise. Don't try anything too strenuous, no weightlifting or anything like that to start off. I asked him, was I going to get a drain? He said, I am going to get a drain. I should be in hospital no more than 2 days. I get my surgery one day and I leave the next afternoon. He said, I'm going to get a drain. He's going to cut me from about here to here. I'm going to get a drain the first day, and then I should get the drain removed before I go home. He said there will be stitches on the inside of my scar. He's not using staples or anything like that. On the outside of the scar, he's using something called Dermablend, which is almost like a surgical glue. And that's supposed to minimize the scar, which I really appreciate. What else? I'm looking at my list of questions that I had, for him. I asked him what would happen if I get to take my medicine. He said bad things will happen, so don't forget to take your medicine. Yeah, I think that's about it. I asked him how soon will I end up having to take the medicine. He said I'm going home on medication, so it's probably gonna be Synthroid. Yeah, so that's where I'm at right now. I'm trying to see if there's anything else I'm missing. Oh, they were talking about the risks that were associated with the surgery. Hoarseness, he said that should only be like for a few days. He said if there's a chance that my vocal cords are cut, he said, which he's planning on not doing. He said, but if there's a chance and I end up experiencing vocal cord paralysis, he said it's not permanent. So it would probably last like a couple months or a few months. And with voice, what do you say? Not voice treatment, but voice therapy and stuff like that, he said my voice will end up coming back to normal. It's a risk of hypocalcemia, which is where my calcium levels could drop. But they're going to monitor all of that, and if so, I'll be on a calcium supplement until that's back together. But yeah, I'm trying to think, is there anything else? I think that's it. So yeah, I'm not going to do another video until maybe the day before my surgery or something like that. I'm not going to do another diary entry until then. So yeah, I guess it's go time. That's it. So just keep me in your prayers. I appreciate the ones who are praying for me. Yeah, that's all. So I will talk to y'all in, I guess, about a week and a half. Bye.